I'm Pip, and welcome to the Midwife Pip podcast, the home of expert information and real chats on all things pregnancy, birth, and beyond. Following my little boy Alfie's scary experience with meningitis at just 5 weeks old, I want to share some key information about this condition that I think all parents should know. Now, to bring you the medical facts and expert information, I'm joined this week by the lovely Dr Lillie, an experienced doctor who has a real love for treating children and better informing parents. So welcome, Lillie, and thank you so much for joining me to talk about this really important and obviously very close to my heart conversation around meningitis.
Thank you for having me, Pip. It's nice to be back on the podcast.
I'm really excited to talk to you about this because I think, and I definitely was in this camp, there are so many kind of misconceptions, I think, around meningitis, especially in small people. And there's lots of things that I think parents probably should understand a little bit more that aren't kind of talked about mainstream. So I'm delighted that we get to pick your brains to make sure that we have the real information, because otherwise it's so easy to fall into that Google rabbit warren or get caught up in, other parents' experiences without having the real kind of facts and medical information. So I'm really pleased we've got you and your brain today. And one of the things I'd love to kind of kick us off with is the different types of meningitis, because I didn't really realise there were so many different types and essentially ways of getting it.
Yeah, thank you. I think, firstly, I totally agree. I think a lot of parents hear the word meningitis and it's quite a scary word, isn't it? A lot of people just panic immediately when they hear the word meningitis, because even if you don't really understand what it is and what it's all about, you kind of know that it's not something that's good. And so you hear the word meningitis, it's a bit like, the C word for cancer. You hear it and you think this is not good. But actually meningitis is a whole host of kind of illnesses, and it's caused by lots of different things. So I think it's important that people understand a little bit more about what it actually means and the different types, as you say. And so that if someone ever does start talking to you about the possibility that your child could have or does have meningitis, you don't immediately start to kind of go to that panic stations. You have a little bit more information behind you. So I guess the first thing is, what does meningitis actually mean? So the meninge bit stands for the meninges, which are actually the membranes that cover the brain and the spinal cord. So this is the fluid and the tissue that covers the brain and the spinal cord. And the itis bit of meningitis literally just means inflammation. So when we say the word meningitis, we mean there's inflammation of the tissues or the fluid surrounding the brain and the spinal cord. And that can actually be caused by a bacterial infection, a viral infection, or even a fungal infection. And I think there was a big campaign when you and I were younger, trying to educate our parents in terms of meningitis, all about the rash and neck stiffness and headache. And that was all around bacterial meningitis specifically. And in particular, bacterial meningitis caused by one bacteria called Meningococcus, which is probably the most severe type of meningitis that children can get. And so they were trying to educate parents to pick it up early so that they could get treatment, antibiotics into them. But there's actually a whole host of different bacteria that can cause meningitis, including bacteria that cause things like urinary tract infections and sore throats, because all it means is that that bacteria, instead of being localized anymore to, say, the bladder or the throat, may have crossed over into the bloodstream and into that fluid surrounding the brain and the spinal cord. And that's when it starts to cause problems. Now, also there's viral meningitis. So this is, again, where you get inflammation, but it's caused by a viral illness. And I know that you know a little bit about this, we might touch on. Typically, this is slightly milder form of the illness, especially in older children and adults. So if you get viral meningitis as an adult, you're going to still feel very unwell, but it's likely to be a lot milder than bacterial meningitis. Now, in young babies, any kind of meningitis is quite significant because they're little and they don't have the same immunity. And so any kind of meningitis could be quite serious for a little baby. But generally, a viral illness is slightly milder than a bacterial illness. And I guess the really good thing to say is that there's vaccinations now, the meningococcal vaccination, that all children receive as part of the childhood immunizations. This actually protects children against the bacterial meningitis caused by meningococcus, pneumococcus, and Haemophilus. And so rates of bacterial meningitis have fallen quite significantly over the last kind of 10 years. I think I had a look before I came on the podcast. In essence, it's now less than 1 in 10,000 children will get bacterial meningitis. But equally, rates of vaccination are falling at the moment. And we know that less children are getting vaccinated. And so I do wonder if we will start to see more of the nasty bacterial meningitis because of that. So yeah, it's a very broad illness. Like there's lots of different types, but in essence, they are all inflammation of the fluid and the tissues around the brain and the spinal cord.
It's so interesting, isn't it? Because I really thought of meningitis, like you say, as that meningococcal, that rash. So top of my brain, although I knew Alfie was really sick, I wasn't thinking, I think he's got meningitis. I knew he probably had some sort of infection that we needed to treat. And I remember the consultant that looked after us said, worst case, this is meningitis when we were thinking about lumbar punctures to diagnose it. And then she came back and went, so it is meningitis. That's the worst case. But best case is it's viral. But we're not going to know until we get all of those results back. So I think for parents understanding, because when you hear meningitis as a parent, that is absolutely terrifying. But then understanding that there is that almost that scope of meningitis, that getting that further information is really, really important. And one of the things that came to me and my husband's mind straight away when we heard that, yes, it was meningitis for Alfie, was our toddler that obviously had been exposed to him and whether it was a contagious thing. And I then had lots of mums that had been in contact with our toddler, with their toddlers, concerned about this spread that we were then going to cause through nursery of meningitis. And we had to then reassure them. So what's the truth around meningitis, Lillie, and it being contagious or not? Because I think that's a massive myth that needs kind of busting.
Sure. You're right. I think historically people think of this meningococcal meningitis, which is, in essence, you can't catch meningitis because you can't catch inflammation of the brain and the spinal cord fluid, but you can catch the bacteria and the viruses that cause meningitis. And so meningococcal disease is quite contagious. And so historically, we were always told that, yes, if someone had meningitis, theoretically, other people may have been exposed to this meningococcal bacteria, and therefore there was a chance that they may also develop it. And we're talking before the vaccination program existed, and typically it was older children. So I think, as we mentioned, we were chatting before, university students, one would get it and then people would have to treat everyone who lived in that house as if they had meningitis to prevent them from catching it. But actually, if we exclude meningococcal meningitis, because now we have these amazing vaccinations that prevent most of those cases, the other bacteria and viruses that cause meningitis are much less contagious. And although you can catch them, you may not develop meningitis if you do catch them. So for instance, there's a bacteria called E. coli. Now this causes urinary tract infections, but in small babies, it can cross into the blood and then into the brain and cause meningitis. If another child caught E. coli, it's very unlikely that they would develop meningitis. It's much more likely that they may develop a urinary tract infection or some diarrhea and vomiting, for instance. But actually, the likelihood that they're going to get meningitis from Alfie it's not going to happen. So we don't have to worry so much now about treating the whole family or treating everyone who they've come into contact with to prevent meningitis, unless it is meningococcal disease, which of course we still see, but it is very rare now, meningococcal meningitis.
My brand new book, Midwife Pip's Guide to a Positive Birth, is now available. So much more than a book, this is a guide that allows me to hold your hand through your birth preparation journey. With over a decade of experience and knowledge packed in to ensure you really are empowered in the way you deserve to achieve a positive birth, regardless of the twists and turns that crop up. Make sure that you get your hands on Midwife Pip's Guide to a Positive Birth book now and are empowered to have the birth experience that you deserve. And I think that's really, really important, Lily. Sorry, everyone can hear Alfie, which is really quite apt considering we're kind of talking about him today. And that I think that's one of the things that I really want to bring across because, you know, we didn't have a rash. It wasn't that kind of type of meningitis. And the thought is that Alfie probably caught it from his brother, bringing something quite harmless back from nursery to him as a robust 2.5-year-old. He wasn't ill. He had the normal snotty toddler nose, I suppose. So obviously had something maybe lingering that wasn't going to cause him any trouble. And Alfie just got really unlucky, in essence. And I think that's important because as parents, there's a massive like blame that you put on yourself. We're like, oh, you know, he's been to those toddler groups with his brother. Maybe we shouldn't have done that. Maybe we shouldn't have done this. And actually, I think it's about, you know, recognizing that sometimes it's just unlucky. And it was kind of, unfortunately for us, out of our control in essence.
It's almost always unlucky. You know, that's the thing. You look at all the different types of meningitis, and as you said, if it's viral meningitis, well, there are viruses everywhere, and especially if they have older siblings, they're always full of coughs and colds and bringing things back from nursery, from school. You cannot disinfect your 2, 3, 4, 5-year-old when they come in the door if you have a small baby every day. It's just impossible. But equally, if it's a bacterial thing, such as an E. coli, or we might touch on a group B strep, which is another type of bacteria that can cause meningitis. These are things that live on our skin anyway, or live in our, you know, nappy area. They live on women's bodies. You can't see them. You don't know they're there. There is no way that you can prevent them getting to your baby. They will, and it's just what happens when they do, whether they manage to get through all of the body's defenses and cause this end game, which is meningitis. And it's really unlucky if that happens, because they've had to get through the skin, into the body, into the bloodstream, and then cross into the fluid around the brain. But of course, this does happen. It's rare, but it does happen. But there is absolutely nothing as parents you can do really to prevent that from happening. So I would say to anyone listening, if that happens to you, never feel guilty. There is nothing you could have done to prevent it from happening.
And sometimes that's all parents need to know, actually, isn't it? It wasn't your fault. So we've talked about that a little bit already, Dr. Lillie, but just so we're super clear, how do babies or really young children then catch meningitis?
So we often split meningitis into kind of two categories when it comes to small babies. So it's either something that they've acquired at birth or around birth. So kind of we're talking, if you have a baby in a hospital, before you even leave the hospital, they have acquired this, the bacteria that will cause, or virus that will go on to cause the problem. Or it happens later. So they've gone home, and as you said, like all the siblings, friends, family have visited, and someone has passed something on to them. And so it's either one acquired at birth or acquired later on. And the reason that's important is because the types, literally again, going into the types of bacteria and viruses that you catch are slightly different. We know that, for instance, group B strep, which is a type of bacteria, is something that can be passed on around or during birth. And so if babies develop meningitis very early in the first kind of week or couple of weeks, we start to think about, could this be something they've caught during the labor process or at delivery? Was mum unwell? And even if mum wasn't unwell, could mum have been carrying something that got passed on to baby during that process of birth? Whereas if they develop it like Alfie a little bit later, say more than 4 weeks, all the way up to 12 weeks, we think more about bacteria and viruses that are in the outside world that may have been passed on to them by somebody else. And in particular, we're talking about babies under 12 weeks old. And the reason for that is because they are particularly vulnerable to meningitis. And that is because before, well, twofold really. The reason it's so worrying in less than 3-month-old babies is because for the first 8 weeks, they're completely unvaccinated. So they have no nice antibodies from vaccinations. The only antibodies they have are the ones that have been passed on to them from mum via the placenta and breast milk if they're breastfeeding. And secondly, they are actually genuinely more susceptible to meningitis because the barrier between the blood and the brain is just not as well formed. So as babies grow, their immune system gets stronger, and that barrier between the blood and the spinal fluid gets more well developed. And therefore, it's less likely the bacteria that are floating around in the bloodstream are going to cross into that fluid and tissue around the brain and spinal cord. So the likelihood of you actually developing meningitis gets less the older you get. But of course, we still see 6-month-olds, 12-month-olds who do develop it, but you're just more high risk in those first kind of 12 weeks of life.
And I love that point on the vaccines, because one of my questions was when we were discharged, Alfie was just coming up 7 weeks and he's due his vaccines tomorrow, his 8-week one. That dread. Those people that have had vaccines before, it's just awful, isn't it? You know that they're really for the greater good, but it just feels horrible. And one of my questions was, do I need to delay them or anything because of what he's been through? And our consultant was very clear and absolutely not. You know, those 8-week vaccines, she was like, get them in as soon as possible because they are so protective for things like this, for little people. And I think it's important often, like you say, there's starting to be a bit of a dwindle in the vaccine programme. And if parents are unsure, I think it's really important that rather than avoiding, that you book an appointment and have a good conversation with, you know, a healthcare practitioner, your GP, your health visitor, so you can really unpick the pros and cons around vaccines. And often when we're not sure about something or we've heard that it's not a particularly nice experience, we kind of shy away from it, bury our heads and just avoid it and hope for the best. But I can definitely say that having a child sick with meningitis is also really not a nice experience. And I will absolutely go through that, you know, that's slight trauma, short-lived trauma of the 8-week vaccines over 10 days in hospital again, you know, treating it. So
yeah, and unfortunately, there probably, you know, there isn't necessarily anything that you can do because you can't vaccinate them earlier.
Yeah.
But as you said, I think that's such a nice thing to advise, actually. If you're not sure about vaccinations or you've heard something, you've heard a rumor and you think, I don't know if I want to give that to my child, book the appointment anyway and go. And you know, no one's going to force you to do anything. No one's going to jab your child without your permission. Sit down and say, you know, I've heard this, or I'm worried about this. Have you got any evidence? Can we go through the papers? Can we go through the statistics? Because it's something I'm talking about a lot on my Instagram page at the moment, because we're really at a critical point in terms of children not being vaccinated. And we've started seeing illnesses that we have never seen really, well, not never seen before, but not seen before for the last 10, 20 years. You know, at medical school, I was not really taught about things like measles, things like whooping cough, because I was told we're not going to see these illnesses ever again. You know, we have almost eradicated whooping cough. We don't see it. And then in the last year, we've started seeing children with whooping cough. And that is 100% down to the fact that less people are being vaccinated against it and people are more anxious. Maybe they put it off. Maybe the appointments get missed. But for whatever reason, we're just not hitting the same level of vaccination. And now we're starting to see these illnesses creeping back in, which as a pediatrician, like really worries me. I've seen 2 children with whooping cough in the last month. I'd never seen a child with whooping cough before in my career up to that point. So it is really important to vaccinate your children. And if you're not sure, to at least get all the information so that you know what you are kind of not doing.
Yeah, definitely. And I think often it's a double-edged sword, isn't it? If we don't hear about these things, we kind of think, oh, well, I won't put them through it because the chance of them getting them so low. But like you say, the more people that have that mindset, the more chance there is of us getting it, the more there is about there. And then we end up with, these pandemic of illnesses that were historical before and actually are ultimately are preventable, which is the kind of saddest thing, isn't it? And we don't want parents moving forward with regret. So making sure you've made that really informed choice is just so important. And one of the things that I really want to get across with Alfie's story, Lily, is that, and I know actually on the last podcast that you came on with me, you spoke about this in your experience as a pediatric doctor, but is around that paternal instinct. And actually, even if there is nothing else worrying you other than feeling like there's something not quite right with your child, especially in that newborn baby phase, that it's okay just to escalate based on that. And one of the signs that we had essentially with Alfie being unwell was that he just woke up in the night screaming in a way that he didn't do before. Now, he wasn't a very peaceful baby at night because he had reflux. So we were used to him waking up crying at night for prolonged periods of time. But we both knew, my husband and I, this wasn't his normal cry. It was like a scream. And I checked his temperature at home at that point and it was 38.6. So they were our kind of, to me, really clear signs that actually he was sick and there was a problem and we needed to get attention quickly. But what other kind of signs or symptoms should parents look out for, or might they see that their child is sick with, meningitis or otherwise, really?
Yeah, I think it's really important as a parent you empower yourself to at least know kind of what's normal and what's not normal, and then you can really trust your gut instincts, as you've said. So like the first thing you said that is an absolute red flag for a baby is a temperature of above 38. So any baby less than 3 months old who has a temperature of above 38 has to be seen by a health professional. So if you have that at home, even if that's the only sign, please, if it's 9 to 5, call your GP 111 out of hours or take them to A&E to get them checked out. I think the difficulty, and we spoke at length about this on our previous podcast, so perhaps people could go back and listen to that, but in little babies, symptoms can be quite vague. In an older child who develops meningitis, they're going to tell you they've got a headache, they've got neck pain, they maybe don't like the bright lights, they've got a high temperature, they're very sleepy, and you're used to them running around the house and now they're asleep on the sofa all day. And then, yes, there's the rash that, lots of people know about with meningitis, a kind of non-blanching rash. So if you press on it, it doesn't go away. But these are all signs that tend to be in older children, and also the rash actually is a very late sign. So it's something that happens once the bacteria has already caused quite a lot of problems in the body. So in little babies, it can be a lot more vague. It can be they're just not settled. They're crying a lot, like you said. Maybe the cry is not their normal cry. It's very high pitched. All the normal things that you do to settle them won't settle them. Or they won't feed. Maybe they're really upset and you think that they're hungry, but they just won't latch. They won't feed. They won't take a bottle. And then also the other end, so they're really sleepy. You can't wake them up. They're really floppy. They're not responding to you in their normal way. These things are quite difficult because newborn babies cry and sleep quite a lot of the time. But you, as their parents, know what is their normal. Now, obviously, if it's the first week of life, perhaps you are still establishing what is normal for them. But I think once you've been at home for a few days, you really do very quickly pick up what is normal for them and what is not. And so even if they don't have a temperature, even if there isn't that red flag temperature above 38, but you think they're not their normal self and there is just something, you can't put your finger on it, but you think, I'm not comfortable here. I wonder if they could be unwell. Do get them checked out. And you did that. But I think even if Alfie hadn't had a temperature, from what we've talked about, you probably still would have used your instinct and been like, I don't think something's not right here, and got him checked out. And I had a wonderful mum who reached out to me on my social media page who sent me a message recently, and she said, oh, you saw me in February in A&E, and thank you for kind of helping save my little boy's life. And it was so lovely. But she had brought her little boy in because she said there's something not right with him. And she couldn't put her finger on what it was. And he didn't have a temperature. And there was nothing, like from a medical textbook point of view, there was nothing that I could have said, this means that he has meningitis, or this means he has sepsis. But she just, as a mum, said, there's something not right here. And they did some observations in A&E, and actually all looked okay. And then I came to see him, and actually he deteriorated in front of my eyes, but they were already in the right place because she knew that. And he got better. It ended up that he also had group B strep sepsis, basically. So a really significant illness that if she had waited could have been so much worse. But just trust your maternal instincts, I think, or paternal instincts. But often it is mums who really, really know.
Oh, it gave me goosebumps you saying that story because yeah, like you say, it's just so important, isn't it? It's so important. And to know that, and even if then you're completely reassured and actually there is nothing wrong with your child, that's okay too. We must never feel like embarrassed or like we're wasting anyone's time because that's what the NHS is there for, essentially. And if I always think if you're worried enough to call somebody or message a friend and say, I'm worried about my child, that's enough of a red flag to be seen by someone, whether that is just your GP in hours or if you need to attend ED, depending on like, your concerns and the severity, that's enough of a reason to kind of to be checked out, I think.
Yeah, and I think if it's an older child, if it's a toddler, your level of kind of worry is just going to be a little bit less.
Yeah.
So if it's a 2-year-old who's got a cough and a cold, you're not going to panic and take them to A&E straight away. But if we're talking about a 3-month-old baby or less, I think there's no level of anxiety that is the kind of correct threshold. Yeah. Like as a pediatrician, if your baby is 3 months old or less and you're worried, come to A&E, speak to your GP, call 111. No one is going to criticize you in those first few months of life. They are quite fragile.
They are. And I remember actually, even when I first approached our GP about Alfie's reflux when he was little, and we have an amazing, amazing GP, and I know services are really stretched. We're so blessed. We live in a little village and we have an incredible GP service. So it might look like this, obviously, for everybody. But I remember booking an appointment, which was, the standard. You have a telephone appointment first and then they invite you in. And he literally just phoned me and said, you booked it at 3 a.m. for a 2-week-old baby. I don't want to talk to you on the phone. Just bring him in. And I think actually that shows that medical professionals with younger babies are a lot more, I don't want to say the word accepting, because I think you're always accepting of parents' concerns, but even more so with a young child because of that uncertainty, and they can't say to you, this hurts. My toddler Finley will say to me, I've got a bad head or I've got a bad tummy. Alfie doesn't have that. So we are then almost more sensitive because we know we need to advocate for them when they can't tell us. And one of the things that when we were unpicking when once we were kind of settled in and being treated, and the doctors were kind of saying to me, how was he in the day-to-day? Was he more sleepy than normal? And I was like, well, yeah, I suppose actually in hindsight he was. But because we were doing lots of things for his brother that day, he was either in the car seat or in the carrier, where he would typically go to sleep anyway. So it wasn't a red flag to me at that point at all. And it was a really warm day that day. So it was a bit warmer anyway. So it was a bit sleepier. And they were like, how is he feeding? And I said, yeah, he's been feeding. And then I remembered when we went to bed that night, I said to my husband, oh, it's really annoying. My boob's really sore because he's only feeding off one side at the moment, which then alerts to that, neck movement and stiffness. But at the time, they weren't red flags to me. It was only in hindsight when we started unpicking it that I was like, oh, I suppose, yeah, you kind of then start to kind of piece it together. But I suppose for parents that may have found those things in the day a red flag, then that's also okay to escalate at that point. You don't have to, get to that point of thinking actually something's really wrong, which I think is something you've highlighted so beautifully.
And definitely don't, as I said, don't wait for a rash. Everyone thinks meningitis equals rash, but it doesn't. We've already talked about that. Viral meningitis, you might not get a rash. Bacterial meningitis, the rash is a really late sign. So, plenty of children get treatment for meningitis and never have a rash.
Yeah. Yeah, we never had a rash. He ended up being mottled all over. And they were like, oh, is that the development of a rash or not? And we didn't think it was. We think it was part of him fighting the infection and being unwell at that stage. So we never had that kind of typical rash. So yeah, definitely not just assuming that. And in terms of meningitis, Lily, how is it diagnosed so that parents have a little bit of an understanding about that process?
Sure. I think it's one of the things I like least actually about meningitis is
you and me both.
how it gets diagnosed. So the only way that we can know as health professionals for sure that your child does or doesn't have meningitis is to look at that fluid that surrounds the brain and the spinal cord. And the way that we do that is that we have to pop a needle in the bottom of it basically goes below where the spinal cord finishes, but it is the bottom of the back. So we put it between the bones of the back, and it goes through, and it goes into a space where there is some of that fluid that surrounds the spinal cord and the brain. And we take some of that fluid off, similar to a blood test, but obviously slightly more invasive than a blood test. And that fluid then goes to the lab, and they start to test it for viruses and bacteria. Now, viruses, they do clever PCR tests where it flags up a little bit quicker whether there is a virus there or not. The bacteria, they put it on a plate and they have to wait for 48 hours to see if anything actually grows. But that is the only way that we can know for sure if a virus or a bacteria has crossed into the spinal fluid. We will also usually take samples from almost everywhere else that we can to try and find out where did it start. So for instance, in an older child who has a sore throat, we might swab their throat. In almost every child, we'll take blood samples and look at the blood to see if there's actually bacteria or viruses in the blood. It may be in young babies, often it is urinary tract infection. So we try and get a urine sample and send that off for culture. If there's a gunky eye, we might swab that. But the mainstay of the diagnosis is this procedure, which we call a lumbar puncture. It doesn't sound nice. It isn't that nice, but in essence, it is so important because without it, we don't know what we're treating. So although it's something that I think as a parent, you would hear it and think, I don't want that for my baby. That doesn't sound nice, a needle in the back. But we're very practiced at it. We do it quite often. And we give pain relief. We hold them very firmly so that they don't move, can't cause any extra trauma. But also those results will just completely dictate how we treat it. Yeah. And I think, is that how you found out what was wrong with Alfie?
Yeah. And, I totally resonate with what you're saying about parents being like, well, I don't want my baby to have that because, I had no medical brain on at the point of Alfie being sick. I just couldn't. I was very much mum mode, so emotionally involved. At this point, I was exhausted because I'd been up all night, been in ED, gone to children's ward, started all the treatment. So I was tired and emotionally involved, and he clearly looked really unwell. So I was so worried about him. And I said to my husband, who wasn't with me, he was with our toddler at that point, but I said, I know the next thing they're going to want to do is a lumbar puncture. And then he arrived before they came in to discuss it. And to him, that, layman's term, it was like, well, okay, if that's what they need to do, that's fine, right? And then she came in and was like, we need to lumbar. And I started crying and he was like, why don't you want him to have it? And I was like, because I've seen them. It's awful. The idea of me making that decision for him to have that felt too much. So I was really lucky in that I said to the consultant who I knew, and I know that's, a privileged position to be in, but I said, I just need you to advocate for him. I trust whatever decision you make is fine. She said, okay, I'm going to make the decision for him that he needs a lumbar puncture. There's no two ways about it. He absolutely needs it. So we had one, which failed. And I was like, oh, horrendous. So she was like, right, but we're going to take him straight away because, he was clearly getting sicker and sicker at that point. She was like, so we do need it. So we then went for a second, which was successful. And we had that initial PCR result came back and showed that it was positive for meningitis. So we found out quite quickly that it was meningitis, but then had to wait that 48 hours for the lab result to confirm whether it was viral or bacterial. So we had that waiting game. But I suppose getting the diagnosis was horrendous, but also really validated the need for that procedure. So that lessened the guilt in a funny way, knowing that actually if we didn't know, we wouldn't be following up and treating him in the way that we are. So it was worthwhile in a way, I suppose, in my brain at that point.
Absolutely. We would not do it if it wasn't completely critical. We don't like putting children and babies through things that they don't need. Yeah. It's the same for blood tests, cannulas. Often parents say, oh, do they really need a blood test? I promise you, I would not be asking you to do a blood test unless I thought it was going to be important in terms of the management. And I think a lumbar puncture is a very invasive procedure, but it is absolutely critical if we think a child has meningitis, because meningitis is a potentially life-changing and potentially even deadly, but significant infection. So knowing what we're dealing with and knowing about it as soon as possible is important. But I think one really important message for everyone listening as well is, if we think your child has meningitis, we will not wait the 48 hours before we start treating them as if it is meningitis. We will start medication, so antibiotics and often antivirals as well, almost straight away, if we think that that is top of our list of what might be happening. And then we will do the investigations and we will wait for the results, but we will be treating the whole time whilst we wait that 48 hours for the results, because we don't want them to get any worse. So don't think that, we're going to do this lumbar puncture and then we're going to wait 48 hours and then we're going to find out that they've got meningitis and they've been in the hospital for 2 days. It's like, no, we are going to start medication now. And then we're going to keep you somewhere safe until we know how long we need to continue that medication. And if everything's clear, and actually this isn't meningitis, this is just a nasty viral infection, then at that point you may be able to go home. But if we do find that this is a bacterial meningitis, they may need a week or even a couple of weeks of IV antibiotics to make sure that that is completely clear and gone.
Yeah, definitely. And so, that's exactly what happened with Alfie. Is he was already on antibiotics actually because of that temperature. So when they cannulated him and did that initial septic screen, they just started them straight away. They then brought in the antiviral medication, which the acyclovir, which I then learned is horrendous for cannulas. So the poor boy was getting through like 2 cannulas a day, which was traumatic in its own light. And also Alfie was having lots of fluid just because he seemed to really need those.
And needed a bit more.
Yeah, he was sort of feeding, but he was so pale and floppy that I think in view of his clinical picture, they just recommended doing that as well. So he was kind of having all that going on and all of his kind of constant monitoring and things. And so, I think it's useful to understand that diagnosis process, because it is really tough as a parent going through that. I've honestly never been as terrified in my life as I was when he was sick and so vulnerable. And I think leaning into medical professionals was a game changer for me and felt really, really important. And I know sometimes the NHS gets a bit of a bad rap, but honestly, the care that we had from the point of Alfie being recognised as a poorly child to getting him better was incredible. It was absolutely outstanding. And I couldn't have been more grateful, and allowing this, beautiful team of doctors and nurses that were just compassionate as well. I mean, we took opportunities when he had pulled all of his cannulas out. I gave him like a quick bath, like silly little things like that actually just made a massive difference to us. Was, things that we will forever be grateful for. And I couldn't, I talk so much about advocacy and making informed choices, and I just couldn't do that at that point. I was just so emotionally involved that I couldn't, which is completely out of my normal character. So it was amazing just to be able to say, make the decisions, do what he needs. That felt like a massive relief for me, I think, at that time. So we'll always be so grateful to those that looked after him.
What's so nice as well is people will listen to this and think, oh well, that Pip works in the NHS, so she was always inclined to think that the care was good. I actually think the opposite. I think often if you work in the NHS, you are one of the most critical when it comes to the care that you receive, because you know how it should be done.
Yeah.
At its best, and you expect that, and you therefore, if things aren't done perfectly, you're quite critical. So actually, whenever someone who works in the NHS says something great about the NHS, like I talk about sometimes that my grandfather passed away in the NHS and the care we received was exceptional. It was so good. And I actually wrote to the hospital and said that because I was so impressed, because I know how it should be done and it was done exactly as you would hope. So it's really in a really bad time, in a horrible situation, but you had the best experience you could have had in terms of the people who were looking after you and making you feel cared for. So that's nice.
Absolutely. And they didn't judge me that I spent basically the entirety of Friday just crying. That's all I did. Every time someone came in, it was never good news at that point, let's be honest. So whenever they came in, all I did was cry. That's all I did. And everyone was just so incredible. Now, as you know, Lily, everyone that comes on the podcast, I ask for 3 top tips. So would you be able to share your 3 top tips on this topic with us?
3 top tips for meningitis. So I think number 1, fever in a 12-week, anything less than a 12-week-old baby should always be seen by a medical professional. Absolutely. That is a kind of, not even a top tip, that is a rule. If your baby has a temperature of above 38 degrees and they're less than 12 weeks old, please get them seen. The only caveat to that is if it's in the 48 hours after they've had their first set of immunizations, because immunizations do tend to give you a temperature. But if it's outside that window, or you don't think it's to do with the fact that they've had their immunizations, then please get them checked out. Number 2, I think we've covered this and we both think it's so important. Trust your intuition as a parent. If you feel something is definitely not right, and even if you go to the hospital and, you know, everything comes back normal and they say, that's fine, you can go home. If you feel really uncomfortable and you don't feel happy to go home, tell someone you don't feel happy to go home. Equally, if you go home and something changes or you still feel very uncomfortable after, say, 12, 24 hours, don't worry that people have told you that everything's fine. You are always entitled to go back, get a second opinion, or get them checked out again. Because people think, well, I went to A&E and everything was normal, and now it's 24 hours later and I think they look worse, but I've already been, I don't want to go back. Go back, it's fine. You know, we will always tell you that. And number 3 is, if you're not sure, it's 3 a.m. and you've got your little baby in your arms and you think they're crying, I'm not sure if this is their normal cries, is their high-pitched cry, try and access some good, reliable information. Try not to doom scroll, or I think I said this on the last podcast, you know, the Google hole at 4 a.m. is a dark and deep one. You will end up way over your head with way too much information. But there are some really good websites with good, reliable information. The NHS website is great. In our area where we live, there is the Healthier Together website. Brilliant. It has all the possible illnesses, all the signs and symptoms. Or if you have someone who you trust, like, you know, yourself, Pip, then there are lots of resources on social media pages, etc. But please make sure that it's a kind of registered medical professional who has qualifications, who knows what they're talking about. But there are good resources on the internet, but there is also deep dark holes that you can fall down. So
100%. And Dr. Lillie's Instagram handle is linked in the episode description and is a really, really great fun. I love your reels. They're really fun ways of getting important snippets of information across about, you know, all sorts of newborn, childhood, illness, etc., and caring for your little people. So do give Dr. Lillie a check out as well. Thank you so much for your time today and for covering this really important topic. I'm really grateful.
It's been so nice to talk to you, Pip, and I'm so glad that Alfie is doing so well now and is home and gorgeous. I can see him. I'm not sure everyone can, but I can. He's very beautiful.
He's
so I'm so glad he's doing well now.
Thank you.
One last thing before you go. As a listener, really help make this podcast successful. I would appreciate if you could subscribe and leave a quick review. Something so little means so much to me and will help so many women's lives.